Mr. President.
Senator from Massachusetts.
Mr. President, I get letters and emails every day from families begging me not to let Republicans in Congress tear up health care in this country. And people aren't writing because they find themselves with lots of extra time on their hands. They're not writing because they are professional activists or political organizers. They're not writing because they like writing letters and emails. They're writing because they're scared. They set aside all the other things they need to do in their days, the sink full of dishes, the load of laundry, the overflowing inbox, and they steal some time to write these letters. They write these letters because they are terrified down to their bones, that if they don't speak out, their family is going to lose their health care coverage. Their children will be shut out from care. Their elderly parents will lose the assistance they need to pay for nursing home care. Their own insurance costs will be going up. Their financial security could be hanging by a thread. A lot of people write letters and send emails, and a lot of people make calls too. Every week since the Republicans started their cruel effort to take away health care from tens of millions of people in this country, my office has been getting phone calls from worried constituents. But last week, something changed. We went from our regular quota of calls about this terrible Republican health care bill to an avalanche of voicemails and phones ringing off the hook. Since last week, I have gotten more than 1,000 phone calls from people who are pleading with me to do whatever I can to stop Republicans who are going forward with their brutal plans. People are literally in tears on the phone. They are scared and they are angry. And they are calling because they know that 13 Senate Republicans, 13 men, are locked away in a secret room behind closed doors, writing a secret plan to trade their health insurance for tax cuts that will go to the wealthiest Americans in this country. The bill the Republicans are negotiating behind closed doors isn't a health care bill. It's a tax cut for billionaires bill, and it's paid for by cutting health care for tens of millions of other Americans. The Republican health care bill has $663 billion in tax cuts in it. $663 billion in tax cuts for the richest people in this country and for wealthy corporations, tax cuts that would blow a giant hole in the American budget. But the Republicans didn't let that slow them down. They kept their eye on the prize. For the Republicans, the most important thing about this health care bill is tax cuts for the rich. So they decided to cut Medicaid by $834 billion in the same bill so they can pay for their tax cuts. You know, this is straight up trade. The Senate Republicans say that Americans should cut health insurance for little babies or for seniors in nursing homes or for people getting treatment for opioid addiction, all so that millionaires and billionaires can get their tax cuts. That's not a health care bill. It's a statement of values. And it says that tax cuts for a handful of millionaires and billionaires are more important than health care for millions of hardworking Americans and their families. There's only one word for what the Senate Republicans are doing with this bill: shameful. It is shameful. The Republicans negotiate in secret, behind closed doors. They refuse to allow anyone to see the bill. They won't tell anyone what's in it. Senator McCaskill asked Chairman Hatch on the Finance Committee if he would hold a hearing on the bill, and he said no. Senator Murray asked Chairman Alexander on the Help Committee if he would hold a hearing on the bill, and he said no plans to do so. No hearings, no reviews, no public look at what the Republicans are up to. What's going on here? I'll tell you what's going on. Senate Republicans don't dare let the people back home see this bill. They don't dare let voters see this bill. Instead, they've decided to try to ram this bill through with no hearings, no public discussion, and get it signed into law. They hope that once that's done, people won't see much point in learning about the details and holding Republicans accountable. They hope that if they can do a quick vote, that everyone else will just give up. Well, I've got news for Senate Republicans. That's not going to happen. Senate Republicans may not want to hear from families who are worried about losing their insurance coverage in the middle of a battle with breast cancer. They may not have time for stories about premature babies who need Medicaid so they can get life-saving care. And maybe they don't want to hear about grandparents with Alzheimer's who could get kicked out of nursing homes. Senate Republicans may not want to hear from these people, but I have a message for these Senate Republicans. We don't care how long we have to stand up here. We don't care how many times you try to dodge the question about what's in your secret health care bill. Democrats are here to keep demanding that you show us this bill, and we're going to keep insisting that you account for its shameful contents. I know you'd prefer to take the phone off the hook so you don't have to hear it ring. And I know you'd like to pretend that there aren't families in your state who would be hurt by this bill. But I'm going to take some time to read you just a handful of the letters I've been receiving about exactly what is at stake in this debate about health care. These families deserve to be heard. A few months ago, I received a letter from Jenny in Worthington, Massachusetts. She wrote to me about how she and her husband got good health care coverage through the Affordable Care Act, and how Medicaid was there when they needed it most, when Jenny was diagnosed with breast cancer. A few days after President Trump's inauguration, Jenny's son, Liam, wrote a letter to the president. Liam asked President Trump not to take away his mother's health care. I don't know if President Trump ever read that letter, but I'm going to read it right now into the congressional record. Dear President Trump, my name is Liam Berry, and I am 10 years old. My mother has been very ill. Thanks to the ACA, my mother has been able to have the care and medication she needs. If you repeal the ACA, my mother will not be able to get the care she needs. I know there are millions of kids in the same situation as me. Please think of them when you read this. Sincerely, Liam Berry. Thank you for speaking out, Liam. We are fighting for your mom, and we're fighting for you. Christine from Cambridge also wrote to me about her fight against cancer. She wrote, I ask that you and fellow senators please fight for the Affordable Care Act. I am a cancer survivor. When I was 28 years old, I got the news no one ever wants to hear. You have cancer. Luckily for me, I had a job that had wonderful insurance, and I was able to get medications, surgeries, and treatment to win the fight and not to go broke doing so. However, I know many young people and old people and children who would not be here today if it was not for the ACA. I know people who are still fighting their battles with cancer. They are frightened and losing hope, not because of cancer, but because they don't know whether they will be able to continue to get treatments necessary to stay in this fight. I am now 30 years old, and I have my whole life in front of me. Because of what President Trump is proposing, I am now afraid that if I lose my job or if I wish to change jobs, I might not be able to get the necessary coverage because I no longer qualify. I really didn't think this is what I would be worried about 2 years ago after having been through 8 rounds of chemo, 20 rounds of radiation and surgery to clear me of this disease. Please, I ask that you fight for us. Fight for those who are in the chemo chair right now at this very moment, who are miserable, bald, and bloated. Fight for the cancer warrior who is now crying with worry because she doesn't know, come a month from now, if she will be able to continue to receive the life-saving treatment she is entitled to. Oh, that's why we're here tonight. We are fighting for you, Christine. We are in this fight. And thank you for speaking out about your own fight against cancer and for others who are currently battling cancer and worried about the future of their health care. I also heard from Sarah, who lives in Shrewsbury, Massachusetts, and who wrote me about her concerns that the Republican health care bill would endanger coverage of birth control and access to services at Planned Parenthood. Sarah wrote me this past weekend while I was out dancing in the Boston Pride Parade. As I typed this, you are at Boston Pride, which I would have loved to be there to support my friends. But due to my endometriosis pain, here I sit. I am extremely concerned about the GOP plan to reduce or strip away insurance coverage for birth control. As a 21-year-old woman suffering from endometriosis, a very common disease among young women, I know firsthand that birth control does more than just prevent pregnancy. In fact, for many, it is the only treatment for them. In 10 days, I will be undergoing endometriosis surgery, and for the past 6 months, since I've been diagnosed until the surgery, birth control was the only thing enabling me to stand up straight most days. Even while taking oral contraceptives, there were many days I was unable to get out of bed, today being one of them. I am so lucky to have access to an amazing endo specialist at Brigham and Women's Hospital and to have access to the medication and surgery that I need. But every time I groan about having to go to an appointment, I think about how many women are suffering from the same debilitating pain, but without the resources to overcome it. Many women rely on Planned Parenthood not just for abortions, but to provide them with the medicine that will enable them to stand up straight in spite of the pain they deal with every day. Endometriosis doesn't discriminate, and it cannot be cured, only treated. Until endometriosis becomes a prominent focus of medical research, which I feel it should be, we must protect the right to be treated for it, which means protecting insurance coverage of birth control and protecting Planned Parenthood. I know that you are a warrior for women's rights, and I know you are the patron saint of Planned Parenthood. I know these are issues you fight for, and I cannot even begin to thank you enough for all you've done thus far. I hope that by adding my voice and my personal story, I can fuel your fire and somehow be a small part in protecting my fellow females and my fellow endometriosis sufferers. That's 1 in 10 women in the U.S. Thank you for fighting for us. Thank you from the bottom of my heart. And Sarah, thank you for writing, and thank you for fighting. We're going to fight to save your coverage, and next year, I expect to see you on the parade route at Pride. I also heard from Dr. Hemel Sumput, who is doctor at MGH Hospital. He wrote in with his personal story, and I want to read parts of his letter. I actually grew up in a low-income family myself. My parents immigrated to the U.S. My mother is brilliant, but had only a 7th grade education because my grandfather couldn't afford to send her to school. My father is college educated, but struggled frequently with unemployment. My older brother has multiple disabilities. He's blind and brain damaged from a stroke during childhood, epileptic, intellectually disabled, and has a transplanted kidney. I am fortunate enough to have been healthy my entire life. For most of my life, my family was on Medicaid, as well as other forms of public assistance. My brother, additionally, due to his kidney disease, got Medicare as well. But Medicaid was always his secondary insurance. He sees multiple different specialists and has done very well over these years. In spite of us having multiple financial struggles, we never had to worry about his health care being paid for. His transplant from childhood lasted 19 years, and then about 10 years ago, he was transplanted again and has done well with that. My parents still live in the same house I grew up in. Right now, they're cared for by Medicare and Medicaid. My brother lives with them, receives SSI, and his health needs are met by Medicare and Medicaid. Although none of his chronic medical conditions can be cured, they are all well taken care of. In the meantime, I grew up healthy, was able to attend Georgetown through need-based financial aid, and was able to get into medical school at the University of Maryland and pay for it using federal student loans, which I'm repaying through the Public Service Loan Forgiveness Program. Got into a dual specialty residency of internal medicine and pediatrics at Penn State, and am now working at Harvard and MGH. My family's struggle goes to show that Medicaid is about helping families that struggle, about helping children with complex medical needs, and about how providing for good health care of a family can achieve positive outcomes for the long-term future. Today, Dr. Sumput works at Harvard and MGH. He makes sure that his patients on Medicaid get excellent care. And he told me about one of his patients who came into urgent care in Chelsea. This little girl wasn't even 2 years old yet, and she was wheezing and had a fever. Here's what the doctor said. This child and her mother were on Medicaid through Mass Health. As I asked questions, I found out more about this mother. She was working 2 to 3 jobs in order to make ends meet. Her daughter was in daycare during the day, and then the grandmother took care of the little girl most evenings. This mom took care of her daughter on the rare days she had off and clearly loved and cared for her daughter. This young girl's wheezing was probably some of the earliest signs of what will become asthma. Her mom has asthma too, and it runs in the family. Asthma is a completely controllable illness with medication, but it requires monitoring by a doctor and access to medication. Because the child has Medicaid, I feel much more confident, in spite of how much the mother is struggling financially, that this child has a good shot at growing up healthy. Without Medicaid, this child could live a life in poor health from a treatable condition. These are some of the people the Senate Republicans want to kick to the curb so they can deliver a big tax cut for millionaires and billionaires. A 10-year-old kid with a sick mom, a cancer survivor, a woman with endometriosis, a boy kept healthy by Medicaid so he could grow up to become a doctor at one of the best hospitals in this country, and help a little girl with asthma. Senate Republicans are willing to tear away health insurance from these families to deliver tax cuts for their buddies. But we're not going to let that happen. We can't let that happen. You're fighting back, we're fighting back, and we will keep right on fighting. Mr. President, I yield the floor.
Mr. President. Senator from Pennsylvania.